For some, that extra weight around the middle just never seems to go away. Many moms wonder, is a tummy tuck a realistic option for them, and how much scarring is involved? Joining us this morning is cosmetic surgeon Dr. Nikko to talk about that. We're so glad you're joining us this morning to tell us about a new technique you have developed. Something new hasn't come along in quite a while about this, so what makes yours different?
Yes, this is very exciting news for all the moms who want to do something for their stomach area, but they're afraid to seek cosmetic surgery or plastic surgery because they're afraid of the scar that's associated with a tummy tuck. Typically, the scar runs from around the waistline to the other side of the waistline. Well, with this new procedure, what I've been able to do is basically shorten the scar from just the front hip bone to the front hip bone, and doing that by doing liposuction to the waistline, and that really improves the waistline and really gives them even a better appearance in their buttock region. Right
now we're looking at a before and after picture. This is one of your patients?
Yes, yes. This
is dramatic. I mean, that is a very big difference.
Yeah, and if you can see the scar, I mean, her scar really goes only from the front hip bone to the front hip bone. And traditionally, most plastic surgeons or cosmetic surgeons would take the scar all the way around to the waistline and not really contour the waistline. With this new technique, we really contour the waistline, and if you can see the rear view, you can really see the improvement in the buttock region also.
I think that anytime there's less scarring, people are always definitely more for that. Who would be the ideal candidate, somebody that would be, the perfect fit for this?
Yeah, well, we see a lot of moms. We see a lot of moms who come in for breast augmentation. They're breastfed and their breasts have fallen, and then a lot of moms who just develop the loose, sagging skin that they can't really work off themselves. And so genetics play a big role, obviously, in how your skin tightens, but what we do is we focus on trying to shorten the scar with the new technique.
Let's talk about the recovery time, because so many people just don't have time to take off work these days. Does it take a long time to get over something like this?
I typically tell patients to take about 10 to 14 days off from work. That'll give them plenty of rest time, and they'll be able to resume normal activity in about 4 to 6 weeks.
Yeah, so that's not too terribly bad, but it is going to take some time out of your schedule.
Oh, yes. I mean, you want to plan accordingly and, have enough time and you want to plan for someone to take care of the kids, of course, for about a week or so.
What type of complications could happen with a procedure like this?
With any major surgical procedures, obviously you worry about infection and other things, but with this with being able to shorten the scar, it really minimize the potential cause for wound problems and that sort of things.
Another thing that someone always is concerned about, I'm sure, is the price. Can I afford this? I want it done, but is it going to fit the old pocketbook? So how does the cost range with other procedures?
Typically, it starts around $5,000 to $6,000, depending on the patient. And if they, you can go to our website, drnikko.com, and they can, maybe schedule a consultation, and we can see everybody on an individual basis and help them out.
They're going to see those dramatic results, I guess, immediately. As soon as their surgery is over, probably a little bit of swelling?
Yeah, that's the great thing with the tummy tuck. Obviously, the results are immediate, and that's the wonderful thing. The picture you saw there was 3 months out, so you can really see that. I mean, a month out, 3 months out, you really can go back to the beach.
And I'm sure that they're going to have to do some exercising and some healthy eating to keep that flat belly.
Maintenance is key, right.
All right, Dr. Nikko, thanks for talking to us, and it's good to hear about your new procedure.
Thank you.